PCOS is just an infertility problem. Actually, that's a myth. Just because you have PCOS does not mean you'll have problems with infertility. And there's more to PCOS than just fertility. It affects a woman from head to toe. And today we're gonna bust this myth and a few others and learn about what PCOS exactly is. So thank you for coming back to watch my second episode of PCOS Healing Adventure with your host, me, Dr. Ami Patel. Another common myth is that a woman caused herself to have PCOS, and that is actually false. The exact cause of PCOS is unknown, but it is believed that it is caused by genetic and environmental factors. Another statement is that PCOS is only in overweight women, and therefore the cure to PCOS is weight loss. This is also a myth because all women with PCOS look different, and it's more than just about weight and weight loss. And actually there is no cure for PCOS, but it can be managed with lifestyle changes. So let's start off by talking about the name PCOS, which stands for Polycystic Ovarian Syndrome, sometimes also known as PCOD, Polycystic Ovarian Disease. Just like the name suggests, syndrome, it means it's not just one thing, but a group of symptoms. Part of the name that says polycystic actually causes a lot of confusion because there actually aren't cysts around the ovaries. It's just follicles that, because of a hormone imbalance, didn't mature and weren't able to release the egg. Therefore, the follicles form around the ovary. These immature follicles look like cysts on medical imaging. But I mean, ladies, are we surprised that there's a confusion in the name? This is what happens when men name a disease that affects women. To elaborate more on the hormone imbalance, this involves high levels of insulin or something called androgens, known as male hormones such as testosterone. Also, there are low levels of progesterone, which cause a missing period. In some women, they may have a period only 3 to 4 times a year, and some women may go for years without a period at all. Because of hormone imbalances, other symptoms of PCOS can present, such as weight gain or difficulty losing weight, or unwanted hair growth, especially on the face, or losing hair from the head. Some other symptoms include mood changes and difficulty sleeping. Another one that's not talked about or known as much is pelvic pain. And by pelvic pain, I mean things like wearing a tampon is painful or getting a yearly pap smear. And I'm not talking about uncomfortable, that's different, but to another level where it is actually really painful. And the reason I bring this up is because I myself did not know that pelvic pain was a symptom of PCOS. I just thought that, okay, I mean, maybe tampons are supposed to be painful. Maybe this pap smear is supposed to be so painful that I dread it every single year that I have to do it. It was only until about a few years ago that I learned that this is actually a problem due to PCOS. Other symptoms of PCOS also include acne, skin tags, or dark patches of skin. If these symptoms are unmanaged, it can lead to other health complications such as heart attack, high cholesterol, diabetes, anxiety and depression, and even something called sleep apnea, which is where you stop breathing for moments in your sleep. If we look at the statistics, it's actually 1 in 10 women have PCOS. That's about 23% of women globally. That's more than the number of women diagnosed with breast cancer, multiple sclerosis, rheumatoid arthritis, and lupus combined. That's right, I said combined. That is so many women. If we look specifically at Indian women, it's actually 1 in 5, which is 20% of all Indian women. This means that everyone probably knows at least one person that has PCOS. Now, with such a high prevalence, so many complications, and risks of developing other diseases, why we don't talk about PCOS more as a society is beyond me. But I'm here to change that, and so are you by watching this video. Because of the lack of understanding, research, and disagreement amongst healthcare providers, there are actually so many women out there that are not diagnosed or misdiagnosed. There are multiple diagnostic tools out there, and it's still up for debate which one is the best one, but the most commonly used one is called the Rotterdam criteria, where 2 of the following 3 criteria have to be met: irregular or no periods, high levels of male hormones, and on ultrasound there are polycystic ovaries. There are actually 4 types of PCOS, and just like everything else in this topic, it's up for discussion what the 4 actually are, but today we're going to talk about the 4 that are listed here. The first type is called insulin-resistant PCOS. This is actually the most common of all the different types, and it's the type of PCOS that I have. The second type of PCOS is something called post-pill PCOS. This is when a woman stops hormonal birth control and has a surge in male hormones, especially testosterone, and therefore it presents like PCOS. The third type of PCOS is known as inflammatory PCOS. This is when chronic inflammation leads to high levels of male hormones, once again, like testosterone. The fourth type of PCOS is actually called adrenal PCOS. It doesn't have much to do with insulin levels or testosterone, but it has more to do with how your body responds to stress. I'm talking about long-term stress, and it's an abnormal response by your body, which also releases another hormone, which we'll discuss more about later. Thank you so much for watching this video and learning about what PCOS actually is and knowing what are myths and what is actual facts. If you're concerned that you may have PCOS or you know someone that does, there's a link that I'm going to attach in the description box below to give you an idea of where you stand and where your hormones are. Actually, I think it's a really great quiz for women to take in general. You can get an idea of your stress levels, thyroid health, and inflammation and exposure to environmental toxins. Before you guys jump to the quiz, I just want to remind you that if you missed my first video, be sure to check it out. You'll learn all about where the name PCOS Healing Adventure comes from and why I started spreading awareness about PCOS. Now, if you learned at least one thing in this video, please be sure to hit like and subscribe so that we can continue to spread awareness about PCOS together. If you have any questions about PCOS or anything I mentioned in my video, please be sure to leave a comment. Thank you. See you next time.